Thank you very much, Dure, and welcome everyone. Thank you for being here. I'm Berta Weil, I'm the research manager at WWP. And today with me, there is my colleague Nora Regosh, who is also part of our research team. And we conducted together the results that we're going to present in this webinar. We're going to present basically the results of a mapping research that we have just very recently finished on the current practices of online perpetrator work in Europe. Some of you may have attended our annual conference, and there in our annual conference, we already explained very briefly some takeaways of this research. But today we want to focus more in detail in describing some of the results. We want to focus on some of the recommendations that the members that we interviewed shared with us, and also some of the challenges and specific actions that they propose to overcome these challenges when moving online. But before starting, we also wanted to know what is your experience with online perpetrator programs. So we wanted to ask you, we don't have time to have very huge discussions because we just have 1 hour, but we wanted to have a feel of who is in the room today. So we wanted to ask you to please raise your hand, your actual hand or the hand in the Teams. Those of you who have already worked online with perpetrator programs. We want to note who of you already has some practice working online in perpetrator programs. So we have 7, 8. I think it's 8, 10, 11. Yeah, so I think that's more or less 11 of you who has already some practice working online from around 42 people that we are here in the room. And now you can stop raising your hand. And please raise your hand, those of you that have thought about moving online or trying to do some online perpetrator work, but that have not yet started. So those of you who are maybe thinking about this, but you have not yet had any practice, you have not yet tried, so you're still wondering how you should do it and if it would work or not. So I see we have 8. I'm moving the screen because I don't have you all in one single screen. Yes, so we have around probably 8 of you. Okay, good. So that's good. So we have around 1/3 of you that has already some practice on working online, and around 1/3 of you that doesn't have any practice, but that you have thought about this. So I will now try to share my screen, and I hope that the webinar today can help us reflect on some of the criticalities and challenges of moving online. Great. So very briefly, because we don't want this webinar to be theoretical at all, but we thought it was important to give a little bit of background. As you know, perpetrator programs have traditionally been delivered face-to-face, but since the COVID-19 pandemic, and also since we have more and more integration of digital technologies into services, social services, and other types of services, the move to working online has been accelerated. But we also know that the practice is still in a very early stages, and there is a huge gap in knowledge. That's why we wanted to conduct this mapping, because we wanted to identify which perpetrator programs are offering services online, but we also wanted to know how they are offered, what are the challenges, how do they organize their practice. But first of all, we want to share a little bit some definitions. What do we mean when we say online IPV perpetrator programs? We think it's important to clarify that under this category, there are several different practices embedded. And this might include, and here you can see different levels of online work. So at the first level, we have programs that offer some elements online as an add-on support to the common or the current in-person work. And that might be some pre-sessions before the group work, face-to-face group work starts, so to do some pre-online sessions, to do some follow-up online sessions. Then we have also some programs that deliver certain phases of the program online. For example, the intake phase. They might do the intake phase online and then see who of these men are could benefit from an online program. Then we have programs that offer online interventions just in an individual format. So when they provide online intervention for perpetrators, they are always on an individual basis. And then we have those programs that have moved entirely online and now they deliver full group perpetrator programs virtually. All of these modalities were included in our mapping, but most of the challenges that we will mention today, focus on these full, let's say, online group programs. So what did we do in this mapping? These were our guiding research questions. We wanted to know which online perpetrator programs operate in Europe, because we still don't know how are these programs distributed, where are they localized. So we wanted first to know this. Then we wanted to know how are these services organized and delivered in practice. And that means, for example, we wanted to know what changes have they done because they have moved online. And finally, we also wanted to know the challenges and which emerging good practices could we see. And here we say emerging good practices because, as we will mention today many times, there is not enough research currently available to assess if the online perpetrator programs that are currently operating are effective and have a good outcome. So that's something that we can still not claim, but what we will propose today are some emerging good practices, some recommendations that other practitioners in the field that have already moved online have shared with us, but these are not, let's say, evidence-based recommendations yet. So to answer to these research questions, first we did a desk research. We wanted to see what research is available out there. And then we did these 12 semi-structured interviews with practitioners of perpetrator programs that are offering some part of the program or the full program online. Basically, in the interviews, we wanted to cover all the aspects that I have already mentioned in the research questions. So, as for the main results, I will very briefly describe the results from the desk research because we really want to focus on the results of the interviews, which is something that we could not cover that much during our annual conference presentation. And basically, as I have already said or mentioned at the beginning, the results from this desk research show that there is very little research, very little guidance, and very few documents available on online perpetrator programs. At WWP, we developed this guidance and these practical toolkits to support online work with perpetrators. That was in 2021. And these guidance were focusing on some of focus group discussions that we had with practitioners who 1 year after the pandemic were still providing perpetrator programs online. And what we saw when we did this focus group is that there was a lack of tools, there was a lack of guidance documents, and there was a lack of opportunities for professionals that were delivering online programs to reflect about their practice, to reflect together about the challenges. So with this toolkit, what we wanted to do is to foster reflection. We were fostering or discussing some of the assumptions that some practitioners had about online perpetrator programs. But at that point, we were still not able to provide specific recommendations because the practice was in the very early stages. But currently, we saw that there are still very few initiatives, very few research studies that describe in detail how victim safety is ensured in online perpetrator programs, how risk assessment is conducted specifically for online perpetrator programs. We have some exceptions of that. For example, the work of Bellini and Westmoreland highlights some opportunities, but also some challenges of online perpetrator programs. but there are very, very few researchers that focus on specific recommendations. And this is what we try to tackle in our mapping. And we also looked at the field of online group psychotherapy. We wanted to know, okay, are there any specific recommendations for online group psychotherapy? But what we saw again is that the recommendations or the guidance were very general. We have Weinberg studies, Hein Weinberg, who also presented at our annual conference. And he offers some reflections about how to deal with therapeutic alliance and group connection when moving online. That might be very useful for perpetrator programs when moving online. But this is not specific research on perpetrator programs. So that's why we were conducting this mapping, to provide specific recommendations and to really emphasize the challenges of perpetrator programs when moving online. So now I will hand over to my colleague Nora, who will present the findings of the interviews.
Thank you and welcome everyone. So on this map, we highlighted the countries where we identified and interviewed programs who offer different levels of online services mentioned by Berta. There might be online perpetrator work in other countries who we missed in the mapping. If you know about such programs, please let us know in the chat. So here, lighter greens indicate exceptional or occasional online individual sessions during in-person programs. Mid green indicates only one fully online group per year. The darker green refers to programs which offer more regular or structured individual and/or group work as part of their services. And the darkest green is the program where most of the services are delivered online. Next, please. Thank you. So what were the reasons that many of these programs mentioned? Why did they move or transition some or all of their services online? Of course, as mentioned by Berta, one of the most obvious reasons to move services online was the COVID pandemic, which was rather a necessity and not a choice. So basically, this was the only way for organizations to continue to ensure program continuity during the lockdowns. For most programs, the transition was rather quick, unplanned, and reactive, and procedures were adapted on the go, so based on what worked or didn't work in practice. But beyond the pandemic or after the pandemic, many organizations found that online formats expanded access for men who otherwise couldn't join or programs, especially those who live in rural or remote areas, so those who otherwise wouldn't have access to such programs. And by connecting participants nationwide, online groups became very viable, even where local numbers or infrastructure were too limited for in-person sessions. So when you didn't have enough people to organize one group in one area or in one location or even one village, now with the online services, it was more accessible to potential clients. And also, online programs offered flexibility for men who travel for work or who live abroad due to geopolitical reasons, or they have irregular schedules. So this also showed that digital platforms could maintain continuity of care across borders and disruptions. So, for example, facilitators and potential clients from Russia, they spread all around the world. And yeah, I could mention other nations as well. So this also allowed them to continue the work. And finally, there's a broader trend we can't ignore, which is digitalization itself. You also heard a lot about it on our annual conference. So technology is already deeply embedded in every part of our lives, including health and mental health services. And as mentioned by Berta, after COVID, general online therapy also became far more common and accepted. So in that sense, this can be considered as an opportunity to explore how technological innovation can support behavior change in perpetrator programs while still ensuring safety for victims and boosting client accountability. So the focus is still on victim safety and clients' responsibility and accountability. So our focus today's webinar is finding responsible ways to integrate technology into perpetrator work without compromising safety or quality. So we will look at all these challenges and how organizations responded or addressed these challenges and what works, what didn't work, and what are the other rooms for improvement. Yes, next, please. So when we asked organizations about their experiences with online perpetrator programs, of course, most highlighted that while digital delivery offered flexibility and accessibility, it also brought a wide range of new challenges, from technical and relational barriers to serious safety and risk management concerns. So we will look at these challenges across four main areas. Here, program structure, facilitation, risk assessment and management, and victim safety and evaluation. So many programs faced practical barriers, as you already can think of a few challenges like unstable internet connection, background noise, distractions, opening many different tabs. Generally, participants have shorter attention span, and it all made really difficult to maintain focus and engagement during the sessions. Also, certain therapeutic methods seem to work less effectively in an online format or some elements of it. And facilitators also often reported less emotional depth or weaker group connection and the difficulties de-escalating when a participant became distressed or shut down. So it's also regarding rules and boundaries, it also became a challenge. So group rules and boundaries, because some men attended sessions while smoking, drinking alcohol, or joining from a public space, from the bus, or being dressed inappropriately, and it required facilitators to intervene and sometimes to remove them from the call. So it was very important to really have clear procedures regarding participation rules, but also clear procedures on contact boundaries. So when and how clients could reach out between sessions, for example, not through the facilitator's personal Instagram or Facebook account at late night, but what are the ways that they could really reach out facilitators between sessions. But sometimes it was also hard to keep because men didn't really keep these rules. And finally, there is still limited evidence or shared knowledge about what structure works best online and whether purely individual, group, or hybrid modes, partly in person or fully online. Regarding facilitation, delivering these programs online requires a different skill set. So facilitators need to manage group dynamics through a screen, read subtle cues from faces and voices, and maintain a calm and safe environment in a digital space. But the lack of nonverbal communication makes this much harder. So small signals like tone, gaze, posture are easy to miss, and clients can also misread facilitators' expression or tone of voices. So these nonverbal communication, lack of nonverbal cues are a limitation from both clients and facilitator sides. And also it was mentioned by some of the facilitators that it could be a bit harder if the facilitator pair didn't have previous in-person experiences, either working together or in-person experience at all. So sometimes maybe it could make coordination online a bit harder, a bit more difficult. And some practitioners also describe feeling isolated or emotionally strained, especially when working remotely. So when you're really also isolated, just logging in from your own room and not having maybe so much of a close connection with your colleagues, with your team. What was also mentioned by the facilitators, that facilitators' confidence and teamwork influenced outcomes. So it's also important to support, to encourage, to help facilitators to become more confident how they deliver these online sessions, because it can have an impact on the outcome, on the program outcome. The online format also complicates risk management. So there's a real possibility that some participants misuse technology to intimidate partners or test boundaries of control. So confidentiality can be also compromised if the perpetrator shares a household, and victims or children might be overhearing the sessions, or they might even appear on the screen. And it's also harder when there's a crisis or emergency situation to act or intervene immediately, because of the geographical distance is much harder. The client can shut down the laptop. You cannot reach him through the phone. He's not picking up. You don't really know what's going on, what happens after the session, and it's much harder to intervene in those cases. Also, there are technical vulnerabilities, which are another concern, like data leaks, or there are no encrypted platforms in usage, or impersonation. So not all the programs require clients to put on their cameras. So in that sense, maybe you don't really know who is sitting behind the screen. But also like we normally emphasize collaboration with local agencies and local partners. But some of the interviewees mentioned that it might be harder to establish such connections, because these services are limitedly available in rural areas or in remote areas. So maybe it's harder to build a network in those cases. And finally, evaluation is still at an early stage, and most programs rely on attendance data or facilitators reflection, but just a few had formalized or validated evaluation tools. And also follow-up with participants or victims after program completion is rather rare, and long-term behavior outcomes are largely unknown. So we really don't know much about the effectiveness of these programs. There are some good practices on the way, or some that had more experience regarding this. But even facilitators or experiences like the stress or their learning curve or their confidence level, or just how their perspective on the program and how it was delivered, it's only documented in a few cases, and there are valuable insights that are not documented. Basically, it's not available yet. But some, as I mentioned, some programs are already working on this, and we will discuss it later. So altogether, these challenges highlight that moving online is not just a technical shift, but it changes how we assess risk, how we maintain safety, and how we build accountability. So there are a lot of things to consider and address in our procedures. So that's next, please. Now we will delve more into the recommendations that are based on the interviews. So what already worked well, what was the experience of these organizations, how did they adapted the different challenges and circumstances, and how we define or how we categorize this, that we will discuss some of the elements that are rather at the start of the program, or that are related more at the start of the program. Some elements are about during the program, and some elements that are related to at the end of follow-up procedures. And there are a couple of recommendations or a couple of elements that are structural, so it's really a transversal or overlapping the whole process, the whole program procedure. Yes. So at the very beginning of an online perpetrator program, careful preparation is absolutely key. So this is what was mentioned by basically all of the organizations, that it's very, very important how you prepare, what is the eligibility criteria, what are the first steps to make it safer, to make it really more effective. So, as mentioned, it's really crucial to apply clear selection criteria to know who I can offer this service, to whom is it safe to offer this service. For example, participants should be emotionally stable, have no suicidal ideation, and they should have the right digital infrastructure and the right level of digital literacy. As you mentioned, they should have a separate device, and they should have a safe space where they are not interrupted, and neither the victim nor the children can overhearing the sessions. So it's also to ensure the confidential space. And several organizations also highlighted the importance of conducting the initial intake or risk assessment in person, if it's possible. But of course, if you offering these online services to clients who live abroad or in really in a huge geographical distance, that maybe it's much harder to deliver. But several organizations mentioned, if possible, at least some parts of the procedure should be in person, so you have really a better idea who you are working with. A mixed model is often the most effective, like maybe starting with the individual intake session, sometimes in person, and then moving into a small online group, usually no more than 5 participants. So this is really similar to in-person or offline services, but maybe the focus how you are assessing risk, what are the risks that you are assessing, how do you really get a better overview of the conditions and circumstances of the client is different. So regarding the length and duration of the programs, as I mentioned, the shorter attention span, it's a factor that we need to consider. So the group sessions are normally 1.5 hours in an online setting, while individual sessions are around 45, 60 minutes long. And one was also mentioned that many of these programs, especially those who offer group sessions, and less of individual sessions, those are rather psychoeducational or webinar-like, or like sending more educational materials and less of deep therapeutical work. And from the start, it's also very essential to set clear participation rules. So what is the acceptable behavior online? Is it also the same as what we expect in an offline group? So they should take it as seriously as they would come to an offline service, and they should apply the same rules. But it's very important to enforce all these rules and always come back, because then like it should have consequences if clients break the rules, and it should be transparent from the very beginning. Also, as mentioned, regarding how clients can reach out to the facilitators in between sessions. So probably many of you already have like a dedicated professional account, either it's an email or a dedicated professional account on social media, or some of you might use different applications like Viber, WhatsApp, Telegram, and so on, but it should be separated from the private or personal account. Also, many programs introduced a safe word. So this is a signal that can be used if the participant is no longer able to speak safely because someone is entered in the room, or there can be other issues as well. And of course, Reliable technical setup is also important, and several programs offered a previous small training on how to use these devices, how to use these online programs. And also during the sessions, there can be some troubleshooting or some provided tablets or separate devices if it was not available for the client himself. But of course, it's also a system that needs to be set up with how to return that device after program completion. But if it's available, if it's only a few clients that needs that, it still might be an investment to consider, because it's really important that clients have their own private device, also to avoid that they are misusing the technology against their partner, but also for confidentiality. Yes. So during the program, once it begins, consistency, structure, and safety monitoring become crucial. So facilitators need to balance engagement with accountability while maintaining ethical and technical safeguards. So at the start of each session, participants should be asked to show their environment, to confirm privacy, and ensure that the camera remains on throughout. So with this, you can really check or monitor that they are alone in the room, and they are able to pay attention, and know no confidentiality is breaching. So it might be also a good practice to allow extra time for technical troubleshooting, even just a couple of minutes, when that we can prevent distraction later. So maybe they can join in a couple of minutes earlier. You can send out a reminder, and then you can really focus on the topics of the session without being needing to handle all these technical issues. As mentioned a couple of times, rules must be really enforced consistently. So maybe it's a verbal reminder first, then you can mute the participants if they are still continuing these misbehaviors, or in an extra case or extreme case, you can also remove them from the session, and then follow up after the session, like what happened, why did you do that? So like really have a separate discussions with them. Some organizations also send materials and short videos in advance, also summaries what they have learned during the sessions, so that also there are handouts and materials that is always there for the men, even during the sessions or in between sessions, that they can go back to and reflect on. And also these can generate, save some time so that you can really focus on the discussions and stimulate reflections, and also avoid the technical issues, like if the video, like not all participant has good connection, then you don't need to stop the video, or they can just really watch it by themselves before that. Here you can still use the breakout rooms or smaller groups where you can encourage discussions between participants, and maybe it also helps a bit to deeper their connections, or imitate kind of a role plays, or imitate the same ways of working together as you would be doing in an offline session. So as also mentioned, you need to define the way how clients can contact you, at what time. So I don't know, from 9 to 5 during the day, or until 6 p.m., 6 p.m., 7 p.m., or do they need to text you before they want to call you? Do you use Viber, Telegram, SMS? So what are the safe ways in which or by which clients can contact you? And it's also important to keep these boundaries really clear and defined and consistently. That's also very important, as we mentioned before, that there are several risky situations, or some sessions might be triggering, and it's much harder to intervene in such cases. So it's good to plan a wind down phase during the session or at each session, or introduce different techniques, emotional regulative techniques that you can practice together with the clients already during the sessions, or have a planning or a planning with them. Okay, if this happens to you, if you got triggered, this is what you can do. So that also there are tools for the men to reach out to or to have access to in such cases. It's also important to have contact of local authorities or services available that can be shared with the clients. Where can they go and where can they seek further support? Yes, some or most of the programs use encrypted and secure platforms. In some countries, there is also a specific platform that therapists could use for online counseling, but even Teams, it's a good platform for that because it's also not keeping any confidential data, and it automatically deletes after some weeks. Some organizations prohibited clients to record the sessions, but they recorded it for themselves to use it for the practice supervision, so they can always look back to the sessions and what facilitators could improve either in their work, or what are the other signals and facial expressions and tone and gesture changes or mood changes that can be noticed if you reflect on the procedure. But of course, you also need to consider all these data protection laws in your country, and behave through consider digital ethics when you are establishing these procedures. We also mentioned that risk assessment during the program regularly is very important, even in online settings, but we know that many of the standardized tools are not really focusing or don't really have any questions regarding the online platforms. So at the end of the webinar, we will provide you some questions that maybe you can add to your risk assessment phase, and you can ask from them. Yes, as mentioned, even if local authorities are harder to reach, but we still would encourage close partnerships with probation, judiciary, victim support services, and local NGOs, so that you also just map the current and local networks that you can work together with in a joint and coordinated risk management. Yes, and finally, what is vital and what we always say in all of our webinars is that to have a structured and confidential contact with victims or victim support services, to really integrate victims' perspective, because if we want to work on their safety, then it's crucial to have their voices integrated to know whether the program really works well or not. And if you can, if it's possible, if they are available, or if they voluntarily willing to engage, to work with you, then it's highly important. And some programs are organized, like if it's a longer work together, like half year or 1 year, working together with clients online. Some of them organize blocked sessions in person for half day or 1 day. And they also reported that already these few occasions can really help to deepen the connection among the participants themselves, and also to develop a more trustful, more reliable connection between facilitator and clients as well. So overall, yeah. At the end of the program, evaluation and follow-up are not just formalities, but they're really essential for accountability, continuous learning, and ensuring long-term safety for victims and families. And because most online programs are still relatively new, this phase is where real evidence about effectiveness can begin to accumulate. So, of course, we recommend developing standardized evaluation frameworks, especially for online perpetrator interventions. And these should measure not only behavior change, but also factors such as participant accountability, relationship dynamics, and victim safety. And the aim is to generate comparable data across organizations and countries, enabling for more reliable assessments of what works and what needs adjustments. So it's basically what we always promote and propose. But in these cases, we really have still very limited longitudinal data or very limited evidence-based data regarding online perpetrator works. In this case, it's even more essential to have such follow-up procedures. And it could follow the same structure to have an evaluation at the beginning, at the middle, at the end, and throughout the follow-up. And you can use even the toolkit, the impact toolkit, if you haven't using that yet, which can be also adjusted to this online perpetrator work, or like using other qualitative feedback also from facilitators, reflections, interviews, or case reviews. And again, it cannot be highlighted enough times to include or integrate victims' perspective, because they are the main focus of our work. To have safety planning with them, if available, assessing risk at several time points throughout the program, and really understanding whether the intervention led to a meaningful behavior change that is consistent, sustainable, and long-term. But we also know that victims might not be willing to participate in such work, but also facilitators' perspective can be very insightful and valuable. So even after each session, you can have debriefing meetings, and to reflect on the procedures, or have supervisions together, case management together if you don't have yet, but probably most of you already do. So, but it's important to structure or to dedicate structured time for that. Also, we talked about the multi-agency collaboration, and it can be valuable to have a monitoring plan with the local authorities after or throughout or close to the program completion. So if you have contact to probation, police, or local social services to help the ongoing supervision and having kind of an aftercare for the client, even after the program completion. And ultimately, consistent collaborative evaluation really transforms isolated online efforts into an evidence-based practice. So I think it's really, really important for all of us, especially a couple of you mentioned that you want to, or you are thinking of moving some services online. Some of you already have experiences, what works and what doesn't work online. So share all these experiences and have a common base or have a common knowledge. It's really, really valuable to increase safety and avoid or mitigate the risks further abuse. So at the structural level, sustaining quality and safety in online perpetrator programs really depends than individual more than individual effort. It requires consistent systems, shared standards, and ongoing professional support for facilitators. So we mentioned several times risk assessment, but it really should be a structural, systemic level, always ongoing basic practice throughout the whole operation. And you can use quantitative tools, different standardized tools like Odaran, Dangerous Assessment, SARA, Be Safer, and so on, completing or adding some qualitative insights like extending it with professional judgments from the facilitators or adding partner feedback and other behavior observations. So, as I mentioned, you can adapt these risk assessment tools. It's more just a checklist for you, but we will provide some additional questions that you can ask that are related to the online part. Okay, facilitators' well-being is also very important, and to avoid isolation or to boost facilitators' confidence. It also works if you have a peer supervision or a professional supervision, external supervision system. You have regular debriefs, team check-ins, and that also facilitators should have access to emotional support or opportunities for joint reflections, but also structured feedbacks or access to trainings, access to guidelines that can be also very important. And regarding the trainings, you can have specialized modules on the different topics that could come up, for example, on suicide prevention or digital ethics, or how to modify certain exercises in an online setting, how to communicate in an online space, what are the virtual group management techniques that can be used, and this should be also available. Some organizations put it as a prerequisite that only those can facilitate online who already have experiences working in offline groups or facilitating offline groups. And it's also, as I mentioned, can be useful if the facilitator pairs already co-facilitated together in an offline setting. So that can make the process smoother. And in some cases, some organizations rotated these models. So in 1 year, someone is facilitating online groups. In other year, they are back to offline groups. So that can maintain continuity, and it can maintain skills and perspective, and they can really learn from both experiences, and then they can develop either the offline or the online work. So it can make models more sustainable. So here are a couple of questions that you can do during the intake phase or throughout the program to identify digital risk and encourage men to reflect on their online behaviors. I'm not going to read that out loud. We will send it to you after the webinar. It really does focusing on emotional regulation and de-escalation, raising awareness of their digital behaviors, and it can capture technology facilitated abuse. And of course, asking about the potential safety risks for victims. So I think we can go to these next steps. So based on what we have discussed, we identified these different next steps and recommendations that can follow our work, and based on the mapping and based on these experiences. As mentioned several times, it's important to have a clear and standard eligibility criteria at the program start, and you have a really structured, regular risk assessment, not just at the beginning, but throughout the program. Again, we cannot emphasize enough to have like a local network of local authorities and collaboration with local services, and do joint risk management and risk assessment with them. And again, safety protocols is a must to our work. And we hope that these steps can also lead to a better understanding of how online perpetrator works and what are the outcomes. So we encourage more research on this topic, more standard evaluation tools to have longitudinal data on the long-term impacts and also on the effectiveness and also the behavior change. What we need is more guidelines, training, and manuals to share, to have a common knowledge, to have a common base, to not just the facilitators shouldn't be isolated, but organizations shouldn't be isolated. So I think our network would be really hopefully a room for that, or a place for that, where all these knowledge can be connected and accumulated, so we can have a cross-country or cross-continental exchange of knowledge and promising practices and lessons learned, and hope that this mapping was a first step, and hope to continue this work. Thank you so much.
Thank you so much. We can move to the Q&A. Also, we forgot to mention that as a result of this mapping, we will be publishing a report with all the results and all the resources that we have mentioned. So you will be able also to read the report. We will share it through our usual channels once this is ready. You have also our emails in the chat, so I don't need to show this slide. We just have 5 minutes. I mean, this was a kind of fast webinar, but I think there is one question. Nora that was asking, maybe we can reflect together, if it has been explored what happens to those who have learning difficulties, who might not be able to use online system to access programs, if facilitators faced such barrier, and if so, how did you overcome it? Furthermore, what about those who are neurodivergent and might require additional support to be able to focus and engage with the material or the program?
I think we didn't ask specifically about the neurodivergent participants, but I think it was kind of what facilitators mentioned, so program mentions that cognitive impairment or emotional instability or severe mental issues like psychiatric issues are kind of an exclusion criteria for that. So maybe for them it's less effective. In cases when you can really have a local contact, maybe a local social service or local probation, where the men can go in and have have a room there and maybe an extra support. So if they have a local helper, a local social worker or local someone, then maybe it could be worked. But I think most of the programs mentioned that these can be rather an exclusion criteria for the reasons or going to individual sessions. But you really need to know and you need to assess that is it safe for the man and for especially for the victim that the man participates, and can you really provide the same level and quality of work that you would do offline. So maybe sometimes it's safer not to engage those men, they engage those clients in online work because it wouldn't work for them in the way that we hope for. It's,
Mm. And there is another question, maybe we can take this one. Given the existing body of evidence, which is mixed, limited to short-term effects and heavily focused on in-person programs in the global north, and recognizing that online delivery introduces new complexities, how can online programs practically and rigorously meet the minimum safety and accountability requirements, specifically the non-negotiable survivor-centered approach and external accountability to women's organizations before absorbing financial resources that could otherwise strengthen critically needed services for survivors, especially in low resource settings?
wow, very complex question.
Very good question. I mean,
Yes.
if I can also support with the answer, Nora, we definitely agree. And we started the webinar by saying that we don't have enough evidence about online
Yeah.
perpetrator programs to suggest that or to foster specific practices. What we had were some recommendations from some practitioners that have really thought about the process and moving online and the risks and the challenges and safety measures. So we really took the recommendations of those professionals that had really thought about this. About the mixed results for the in-person perpetrator programs, we definitely agree also. That's why we developed, I put it in the chat, this specific tool to assess the outcome of perpetrator programs with a victim-centered approach, meaning that we are not just assessing as an outcome, behavior change and recidivism and so on, but we also include victim safety, such as this increased space of action for victims at the Mirabel project. So we really want to see if programs are impactful and efficient to increase victim safety, also in the face-to-face, in the traditional perpetrator programs, and especially in the online programs. But we still don't have evaluations with this approach for the online programs. For the in-person, yes.
Yeah, and probably you mentioned, I just wanted to reread the question again. So
Yeah.
one program was specifically developed kind of together with the victims. So like as the program went on and they had some parts that are like this webinar like modules that the men can do by themselves with the help of a counselor or a helper, but the pilot version was like throughout the whole procedures they contacted the victims themselves, and they included all of their feedbacks, and it was really on the focus of victim safety. There are some other organizations who for whom is the criteria that they rather work with those who are not sharing the same household, so they probably are no longer together, or they don't live together, so the men are really live separately. But yes, with the rest, I agree with Berta that, yeah, that's why we emphasize. I don't know. Probably I can count how many times I said risk assessment and risk management. For these reasons, so the concepts are very valid.
And about the resources, we always emphasize that government have to have different lines of funding for perpetrator programs and victim services so that they don't, take one from the other. So this is also something that we always try to recommend when we lobby and when we discuss with governments. I don't know, Dure, do we have time for a last question? Because I think that's a very interesting question, also the last one we have in the chat.
Yes, sure.
Maybe we can post the evaluation form if someone has to leave. Also, before leaving, please answer our evaluation form, because for us it's very important to report our impact and to know about the usefulness of our actions for ourselves, but also for the Commission. So the other question is, there is a myth that online programs are less expensive to run than in-person programs. If anything, they require greater preparation and planning time. Is there a risk that governments might seek to fund online programs in place of in-person programs because they mythically think they are less expensive to run? That could be a risk. And indeed, many of the facilitators with whom we discussed, they were kind of recommending a mixed approach, right, Nora?
Yeah.
So we would, I mean, in the current stage of the field, we would never recommend to fully move online the whole programs, because the in-person probably has some elements that are very important and very crucial. But when moving online, we have to think about, why are we doing that?
Yeah.
Is it because we would reach men that otherwise we wouldn't reach? I mean, what are the reasons for moving online? It's not for cost effectiveness usually. It should be because we are reaching men that usually would not be there otherwise. Because if not, you can already do it in person, probably, no?
Absolutely. And we mentioned more this on the annual conference, so
Yeah.
we didn't detail it here, but it's really not for the facilitators and not for the client's convenience. And regarding the risk assessment, who can be offer these online services, some of them mentioned that it's rather lower risk clients, or first time offenders, or the ones who have yes, living in the rural area, but also um, for those who have some social anxiety and stuff. But it's really not for the convenience of the clients, and you need to really make sure that if so who is included, um, it's not increasing risk for the victim, but really reducing the risk. But yeah, but some of the programs really got granted, like they didn't start during COVID, or maybe they started, but after that, based on the positive experiences, they got funded from the government to continue with their online work. But
But
it's
it's true
really
that
not for everyone.
there is this myth that they are less expensive, but to start a program like this, you need a lot of reflection, you need to invest resources. So at the very beginning, it's not,
Yes.
it's
Yes.
probably not for cost effectiveness that you would do it. You would have to do it for other strategic reasons. Okay, so I think, Dura, we have to close it here, maybe. Thank you very much for
Thank you so
attending the
much.
webinar, for being so active. We hope that this has been useful food for thought, and to start reflecting about the criticalities of moving online. And please contact us if you have any other comments, any experience, or also general research in perpetrator programs that you want to share with us, because we are more than happy usually to collaborate. So yeah, and always
Yeah.
please include both of us in the emails.
Yeah, and also some of you mentioned that you're thinking to move online, and those who already have experiences online, and anyone else who participated, you can really share your ideas, concerns, things that you agree or disagree, or something that we missed, because we really want to have this common knowledge and we share with everyone, so that we can really keep the quality of the work. So we really need your inputs. We need your inputs. Thank
Thank
you.
you.